Hi, and thank you for your interest in our evaluation of neighbourhood health. In this presentation, I'll be explaining what our evaluation of neighbourhood health will be aiming to do and how we will be aiming to do it. You can access these slides and the full evaluation protocol on the IDEAS.net website. First of all, just a very quick introduction. My name is Jason Scott and I'm Professor of Applied Health Research at Northumbria University. I'm also the Deputy Director of the IDEAS National Evaluation Team, and I'm Co-Principal Investigator of the Neighbourhood Health Evaluation, along with Professor Angela Bate. We're a national evaluation team funded by the National Institute for Health and Care Research, and whilst there are many people involved in the design and delivery of this project, unfortunately there are too many to name here, but you can find out details of everyone that's involved on our website. So first of all, just a little bit of background to this project. Neighbourhood health is a central commitment of a 10-year health plan for England, and it aims to improve health outcomes and reduce health inequalities via integrated neighbourhood care models that bring together health and social care, voluntary and community sector organisations, and wider public services such as local authorities. A key feature of neighbourhood health is that models will be locally determined to reflect the local needs and priorities, which means that no two models will necessarily be comparable in their design and/or delivery. Our independent evaluation, which we're conducting on behalf of the Department of Health and Social Care and NHS England, aims to generate theory-based explanations of what works, for whom, in what circumstances, and why. The design of our evaluation was underpinned by extensive work in the autumn of 2025, where we worked with over 100 stakeholders representing various sectors and organisations, and people who were likely to be involved in or impacted by neighbourhood health. So onto our evaluation itself. It starts in April 2026 and runs for a period of 3 years. In the evaluation, we're using a realist approach with a mixed methods comparative case study design. Realist evaluation is a theory-driven approach to evaluating complex service innovations and is therefore designed to account for the inherent messiness that comes with neighbourhood health. In the evaluation, we have 5 work streams that link with each other, and in the following slides, I'll be explaining each of these work streams. Our first workstream runs for the full 3 years of the evaluation and covers how we will engage stakeholders and perform knowledge mobilisation. That is, how we'll make sure that what we learn throughout the evaluation reaches the people who need to know this. Our objectives are to plan and undertake inclusive involvement and engagement activities at all stages of the evaluation with key stakeholders. That includes public and patient involvement and engagement representatives. We will be planning our impact strategy, including how we intend to share our findings with all stakeholders in appropriate formats to do so. And we also want to understand changes in local, regional and national policy that may affect the design and delivery of neighbourhood health. To do this, we'll be developing an inclusion, engagement and knowledge mobilisation plan and a public and patient involvement and engagement plan, and again with input from stakeholders in doing so. We'll be identifying and recruiting stakeholders through existing networks and developing a directory of stakeholders to work with us throughout the evaluation, and then involve those people at key time points to get their feedback and input using a mix of online and in-person activities. And we'll also be co-developing our plans on how and when to share findings with different audiences, and we'll be reviewing this throughout the course of the evaluation to make sure that it is up to date and relevant. And we will be undertaking some horizon scanning to look for relevant changes to local, regional, and national policies and guidance that relate to neighbourhood health. Our second work stream runs for the first 6 months of the evaluation. Here, we want to develop a taxonomy of the different ways of working in relation to neighbourhood health. That includes the ways in which it is designed, organised and delivered, and also taking into account historical, structural and relational contexts of neighbourhood health. Here, we will be performing a review of policy documents related to neighbourhood health and conducting a national researcher-administered survey to identify what is currently happening in relation to neighbourhood health across integrated care systems. From these, the output will be a taxonomy of neighbourhood health, but will include neighbourhood health archetypes, which is a relatively high-level system for classifying different approaches to neighbourhood health. This will be essential for when we select our case study sites in Workstream 4. Our third workstream also runs for the first 6 months of evaluation at the same time as Workstream 2. Here, we want to develop our initial programme theories of how neighbourhood health may work for whom, in what circumstances, and why. To do this, we'll be conducting a scoping review of peer-reviewed and grey literature of neighbourhood health type integrated care interventions. We'll be conducting a review of existing theories of integrated care to identify frameworks that can inform our understanding of how neighbourhood health is expected to work. We'll also be drawing on secondary data from the national survey that we'll be conducting in Workstream 2, as well as the documentary review and the series of workshops that we held in the autumn of 2025 to help us to design this evaluation. And using a realist approach to develop the initial programme theories and an initial theory of change, which will then be sense-checked with stakeholders. The outputs from this workstream will include a scoping review of models of integrated care, our initial programme theories of neighbourhood health, and a robust data collection and analysis plan that we can take into the fourth workstream when we begin data collection in our case study sites. Our fourth workstream is a significant portion of our evaluation. This workstream will be running for 2 years, starting around about October in 2026. In this workstream, we'll be using the taxonomy of neighbourhood health and the identified archetypes from Workstream 2, along with ensuring that different geographies and demographics are represented to identify sites for our evaluation. In these sites, we'll be testing and refining our programme theories that we developed in Workstream 3. We'll be working in up to 6 deep dive sites where we'll be using comprehensive qualitative approaches to test our theories with various stakeholders, along with various forms of quantitative data to test outcomes associated with neighbourhood health. We'll also be working in up to 30 high-level sites where we'll again be collecting quantitative data and more limited qualitative data to test our theories. As this workstream will be ongoing for 2 years, we will look to identify how things progress over that time by collecting longitudinal data, and we will also synthesize data across the different sites. We also recognise that we won't see the same level of maturity across all sites in relation to how neighbourhood health has been developed and implemented. Our fifth and final work stream will be conducted towards the end of the evaluation, approximately in the final year. In addition to recognising that neighbourhood health maturity will not be the same in all sites, we also recognise that not all intended outcomes can necessarily be evidenced in the relative early stages of neighbourhood health. Therefore, in this work stream, we aim to model the long-term outcomes and the funding flows for the different types of neighbourhood health identified in our taxonomy developed in Workstream 2. To do this, we'll be conducting a pragmatic literature search to identify suitable predictive modelling approaches that are relevant for neighbourhood health. We'll be using the outputs from the taxonomy and the programme theories to specify and prototype the model using synthetic data initially, and then we will test and incrementally refine the model parameters, working really closely with our stakeholders through a series of workshops to help us to identify what should be included within that. And finally, we'll be implementing the finalised model and developing a user tool for continued use beyond the evaluation. We will of course be sharing our findings with as many people as possible in various different formats and throughout the whole evaluation, not just at the end. As a starting point, this will include policy briefings, stakeholder events, and more standard approaches to reporting research findings. As part of Workstream 1, which was about knowledge mobilisation, we'll be actively working with stakeholders to make sure we know what to share, when to share it, and how best to share it. For instance, I fully expect us to record more videos like this one to explain particular findings from our evaluation. And finally, just to close the presentation, if you would like to find out more about our research, would like to take part in any of the stakeholder activities we have planned, or even just be kept up to date, then please contact us. You can see our contact details here, and you can also find these on our website. Thank you very much.